Good morning, good afternoon, and good evening to the viewers of this on-demand video presentation. First of all, I would like to thank the Philippine Academy of Family Physicians for this invitation to talk about a very timely topic, the COVID-19 pandemic and the older person. Specifically, I'd like to talk about providing care at home and in living facilities during the pandemic. These are my affiliations, and I'm not in any way affiliated with a drug company right now. The objectives of this presentation are to present the current situation of older persons in our country using data from the UP Population Institute and the COVID-19 tracker of the Department of Health. Further, I would like to be able to describe the physical and psychosocial impact of the pandemic on older Filipinos, and later talk about dementia, the other pandemic that our country is facing. I am also going to share some best practices in assisted living facilities on infection prevention and control. Finally, as it is already being discussed, I would also like to share with you the National Institutes of Health Institute on Aging recommendations for COVID-19 immunization for older persons. To round up the whole talk will be an emphasis on the key message of promoting active and healthy aging. Well, I already talked about two kinds of pandemic. There is the third one we are facing today, and this is population aging. Within 10 years, there will be 1 billion older people above 65 years old worldwide. One of the reasons is that we are really living longer. For example, in 2015, the global life expectancy in developed countries is 78 years, whereas by 2050, this will be 83 years. In 2015, the global life expectancy in developing countries is 68 years, and in 2050, it will be 74 years. I am not sure now if this projection will still be true with the 2 million coronavirus deaths today, but these estimates by the HealthPage International are true until 2020. These graphs also show that in 30 years, or by 2050, and I will be 92 years old by then if I will still be alive, it shows that 80% of the world's older people will already be coming from emerging and developing economies. It only means that if we will be living up to 2050 or beyond, we will be experiencing an aging world with different needs from 100 years ago, the baby booming years. We now see a lot of lolos and lolas, and also I am lola to the children of my nieces, nephews, and friends. But the reality is our country is aging very slowly. We are still a young nation until now, owing to the 9.5% proportion of 65 years old and above in our country. This is because of the adherence to the United Nations categories of young, aging, high aging, and hyper-aging nations. Japan is in the top of the list of hyper-aging nations, followed by Italy. Singapore, with 22% seniors, is a high-aging country. Down below the slide is our median age of 26 years. This is the other way to say if we are an aging country. 26 years definitely is a young age because 26 years means 50% of the population are above 26 and the other 50% is below 26 years old. And that means that the Filipinos as a nation are indeed still young. The population pyramid of 2018 by the Philippine Population Commission shows that below the age of 60, there is a greater proportion of men than women, and beyond 60, the reversal occurs. More women are living longer beyond 80 years, implying that men have a younger life expectancy than women, and we call this the female longevity advantage. This may be good news for women, but living longer may mean not living life to the fullest for some, as it may mean having comorbid illness or living in relative disability, such as having difficulty in performing activities of daily living. And the causes of these relative disabilities are physical impairments, such as visual and hearing, that are age-related, as well as physical conditions such as osteoarthritis or sarcopenia. These conditions lead to frailty, a geriatric syndrome that herald the state of vulnerability of older persons, vulnerability to infection, complications, and death. For a more accurate description of the situation of the elderly in our country, the Philippine Longitudinal Study on Aging and Health, done October 2018, is a comprehensive database of 6,000 older Filipinos. It its emphasis is on their health and well-being, and they have been followed up for 2 years after their initial interview to be able to detect changes in parameters noted in the first interview. For this presentation, the highlights of their state of health will be presented in the next slide. Many older Filipinos are in poor health. Data taken from an interview showed a high percentage of elderly with poor dentition who are underweight and have multiple comorbid diseases, hypertension and diabetes topping the list of comorbid states. Interviews were done October 2018 to February 2019, showing already difficulties in performing activities of daily living, such as transferring and mobility, and visual and hearing impairments. The reports were consistent with other data about the functional capacity of senior citizens. Indeed, functional decline is an expected change in the senior years, but what makes them more vulnerable and needy is that many of them admitted that they needed medical attention but were not able to go due to financial considerations. Many of the elderly are financially dependent on children, which is possibly the reason why many are still working, as the ability to buy maintenance medications and pay professional fees is lacking. No wonder then that access to healthcare is absent, even if healthcare is available. The government has a program of social protection for the vulnerable, but this is not enough to meet the basic needs for sustenance and health. Not all have pensions from previous employment, and it is also said that the pension system from private corporations is inadequate, again, to meet the cost of living and being able to live well. This is a not so happy situation for older persons, hence they should really be considered the most vulnerable in this pandemic. Still, besides being in poor health and in financial inadequacy, the respondents showed a high level of satisfaction and social integration. Many of them are engaged in active intergenerational exchanges of communication, visits, and help with child care. In the Filipino society, having an extended family can be mutually beneficial to the nuclear members and the lateral supports. In fact, for almost everyone, the grandparent role is satisfying. Grandchildren are an important source of happiness for them. They were also asked about who they would turn to for help when needed, and most of them said that their source of support are prayers, family, and friends. Now, what is the impact of COVID-19 on our elderly? An extract of the COVID-19 cases from the Department of Health COVID-19 data tracker of May 2020, which is early in the pandemic, showed that it is the 50 years old and above who are at high risk for the disease. And there is a highly imbalanced sex ratio with a higher proportion of positive cases among the men from age 34 to the oldest age group. Please see Figure 2. Furthermore, among the 38 recorded deaths in this data, 89% are also 55 years old and above, with more deaths among the men than the women. So in short, the morbidity and mortality from COVID-19 is high among elderly men. Hence, age and sex are risk factors for the disease, and those in more advanced years have a higher probability of dying from the disease. As we have said, it is the 55 years old and above where share of recorded deaths in the early stages of the pandemic is highest. Even in nursing homes, as declared by the American Association of Retired Persons, deaths due to COVID-19 infection are also high, about 40%. The data in this paper also echoes the reasons noted in other studies why death is higher in this age group. Advanced age, the presence of comorbidities, and being immunocompromised are the three reasons for why death is high in this age group. Advanced age in our country is an independent factor because of the intrinsic characteristic of Filipino elderly being in poor health to begin with and have lack of access to health care, that when they are brought for medical attention, it is already too late. There are also many reasons for unstable comorbid diseases. For example, lack of access to medications or follow-up consultations for refill of prescription. There are also severe chronic diseases that can put them in immunocompromised state, for example, cancer, chronic respiratory disease, stroke, or having chemotherapy. These are all the reasons why the older persons, either at home or in the nursing homes, are at higher risk for death due to COVID-19. Anxiety and depression have been established as causes of psychosocial issues among older persons and their families even before the pandemic. Hearing about the effect of the disease among families that are affected may trigger bouts of emotional instability, anxiety, and depression. Although many of our older persons are socially well integrated because of the lockdown and or quarantine, 1 to 2 weeks of being away from loved ones can trigger anxiety, depression, and other negative emotions. It can also cause behavioral problems. Furthermore, those who are hospitalized are usually subjected to prolonged hospital stay where a hospital policy on no visitors allowed is enforced, projecting more feelings of isolation. Not only that, there is lack of access to medical care because clinic operations are also limited. And the consequence is the inability to refill prescriptions of maintenance medications right away. What is the impact of dementia, or what is the impact of COVID-19 on dementia? Even before the pandemic, dementia patients are a challenge already to take care of. Cognitive impairment can cause difficulty in understanding and remembering instructions Hence, they may forget to wear masks and face shields or wash their hands. They are prone to behavioral and psychological disorders. Being at home all the time becomes a mental puzzle for family caregivers to keep them active, claim their calm their agitation and aggression, and administer their medications. They can also be affected by social and economic losses, for example, death of family member or loss of job of the family member. Therefore, their care can also be affected by the negative turn of events. And usually, they are prone to non-COVID health conditions or emergencies that need immediate medical attention, and there is fear of going to the hospital for this. So far, to allay the social isolation while on lockdown or quarantine or hospital confinement, technology such as FaceTime or tablets for communicating with loved ones has been a successful strategy. Frequent phone or video calls will bring them back to the family situation that is familiar and comforting to them. Hence, this is a highly recommended practice. Telemedicine for consultation and prescriptions, even for family conferences, is now being done as a substitute for face-to-face consultation. The This connects the doctor to the patient and the family who always need reassurance when taking care of their loved ones. Even pharmacists are already accepting prescriptions and home deliveries of maintenance medications to answer this situation of restricted mobility of older persons due to the lockdown. Now, how do we take care of older people who are at home? Preventive health care during this pandemic is the best guiding principle so far. Even if at home, maintaining the physical, mental, and social well-being of the elderly are still paramount. Physical activity and regular exercises are to be done alone or with family members. Mentally stimulating activities such as reading, writing, painting, doing creative projects like making an album can be done not only for entertainment but also for occupational therapy. Brief social engagements may be done, but digital communication is safer. Receiving and returning video calls have been known to provide utmost joy and reassurance that the family members are okay. Going to public places should also be minimized, and as I have said, if going out cannot be postponed, the proper protective equipment should be used. Mask, face shield, and also with an alcohol with the patient. Continuing on, no, for taking care of older people who are at home and don't have COVID-19. Even though as a nation we are highly optimistic, there is a high probability due to this pandemic that people close to us can be infected. We must be prepared for any kind of eventuality, together with the acceptance of temporary isolation from them when this happens. Prayers are an effective, protective weapon for everyone, so praying for everybody is encouraged, as this will draw the attention away from their own discomforting thoughts. It is still very important to seek medical consult, and if the attending physician is not available, there has to be a backup, even by teleconsultation. Lastly, family members need to monitor each other for signs and symptoms of the disease and also seek consultation right away. Especially for older persons, earlier detection and early treatment will avoid premature death. Home care may be considered for an older adult suspected of or with confirmed COVID-19 when inpatient care is not possible or it is unsafe. Home quarantine may also be considered after hospital discharge for as long as their comorbid diseases are stable or can already be managed at home. But it must be remembered that these patients run the risk for transmitting the disease, so the companions at home, as well as the setting, need to be evaluated if they can take care of the older person safely with them or the others in consideration. An ideal isolation room is one that is exclusive for the senior and perhaps the caregiver if needed, with also a bathroom that can be exclusive for them. The BERTS, the Barangay Health Emergency Response Team, or a home care team have to be notified so that periodic checkups, even by phone, can be done. It is also good that there are monitoring devices at home such as the thermoscan, blood pressure apparatus, and a pulse oximeter that can be used by the caregiver. Changes in vital signs can be reported right away and be assessed. Supportive symptomatic treatment should also be available at home. As much as possible, an RT-PCR negative caregiver should stay with the patient all the time, but if he or she becomes symptomatic, check-up and treatment needs to be done right away. The necessity for replacing the family caregiver must also be weighed against cost and benefit for the patient and to the family, but a backup caregiver may be allowed. Finally, the discharge from quarantine is a necessary step for the emotional well-being of the patient and the family as well. In assisted living facilities, there are professional health workers, and the relationship between the clients and health workers are also formal. There are three simple principles to be followed in infection control in the nursing home. These are: do not bring in the disease, do not spread the disease within the home, and do not take the disease out of the home. A no visitors allowed policy effectively enforces this, but the nursing home staff should send daily updates regarding the clients to their families. Health workers, if allowable, should use personal protective equipment and sleep in the home to minimize exposure to the public. If allowable, there has to be periodic testing of staff as well as staff immunization. Also, the community has to be educated about the presence of assisted living facilities and should prioritize the staff and the seniors also for COVID-19 immunization. Lastly, nobody will argue that hand washing is still the cheapest and most practical infection control strategy. The question here is, will you vaccinate your older patient? Or maybe a more personal question is, will I vaccinate my parents? Okay. The National Institute of Health, Institute on Aging recommendations on COVID-19 immunization are the following. COVID vaccines are generally safe and only the most effective vaccine brand for older people will be recommended for them. Older people are the best candidates for COVID vaccination, especially because many have chronic diseases that predispose them to complications and death. The frailest and the near end of life may receive the vaccine, especially in nursing homes where strict infection control is necessary. Close monitoring and tender loving care, such as family, caregivers, need to be ensured for the frailest and persons with dementia. Now, 2 days ago, the Department of Health has already issued the decision tree for immunization. Okay, and older persons might always be considered in this category. It, the Department of Health says that we should not vaccinate the less than 16 years old, those allergic to polyethylene glycol or polysorbate, and had a severe allergic reaction after the first dose. Okay, vaccination may be deferred. Now, when patients are symptomatic at the day of the vaccination, are recently exposed to COVID-19, or had COVID-19 in the last 90 days, or with convalescent plasma. Healthcare workers who are pregnant in the first semester, okay, may also have deferred immunization, okay, as well as those who have received any vaccine in the last 2 weeks. Now, most probably, the patients, your older patients, no, will fall into this category. Those with immune diseases, with HIV, have cancer of any kind, and are taking immunosuppressants such as steroids and anti-neoplastic treatments, as well as the transplant patients. Okay. This special population needs clearance as emphasized by the Department of Health. An adequate check of the stability of these conditions need to be done by their attending physicians prior to clearing them for vaccination. The bedridden, the terminally ill, with an estimate of less than 6 months prognosis, are also a very vulnerable population, and it is highly encouraged that a family conference with the patient be done first for discussion of values and life goals and expectations. Lastly, special precautions should be given to patients with allergy to food, medicines, and asthma, as well as those with a history of bleeding or who are taking anticoagulants. Finally, in caring for older persons, the general strategy is to promote active and healthy aging, and the goal is to maximize functional ability despite the impairments that occur with aging. Functional ability refers to the health-related attributes that enable people to be and to do what they have reason to value. And this is determined both by the intrinsic capacities of the individual and the influence of the environment they inhabit. So in short, whether in disease or in illness, at home or in nursing homes, we still have to promote active and healthy aging, okay, despite the numerous physical, physical and emotional impairments, as well as the psychosocial impairments imposed by age and disease. We have to maximize the functional ability of our older persons for a better quality of life. On behalf of the Philippine College of Geriatric Medicine, we thank you for this opportunity to share with you what we know about caring for older persons in this pandemic.